Perfect, we see you. Oh, you're muted.
And now I'm on. Okay,
yes.
Good. Hi, okay, let me get shared here first before I get going too far. Make sure.
We see your slides, perfect.
Okay, I'm gonna just wait a second because I can't see them now, so.
There is a little bit of a lag I've noticed, so absolutely. And if you want feedback on what we can see, I'm happy to let you know.
Okay, I think this is on the PDF, so I'll just scroll, so bear with me through that, but this is what we need to see. So, good afternoon, and thank you for having me, Colleen, and the rest of the people on the call. Thank you to Althea for setting that up so nicely. The overview of what the Health Commission does and the role of, Yellow Hawk in public health for the community is super important, and it plays right into exactly what I'm going to talk about. So just for people that I haven't met, a lot of you I've seen on the call that I know, but for those of you who don't know who I am, I'm currently in my third year of doctoral studies here at OSU. I have done all my education here at OSU. I'm very well connected, and that has given me the opportunity to partake in a lot of different activities that are surrounding public health, and also to help inform, some of these things, some of these gaps that Althea laid out really nicely, where the Indigenous knowledge, the way that we think of the world and what we holistically view as health doesn't always match what what the modern science description is of health. It's getting better, but a lot of my role here throughout my schooling. So my undergrad, I got my double bachelor's degree in biocultural anthropology and public health management and policy. And then my master's program was also in management and policy. I did do a 5-year stint out at Hanford. So that really got me, thinking and communicating with people what those differences are and how we view health. Because I was here, I found myself in charge of projects where we're trying to protect human health by cleaning up these sites, but then the cultural aspect was being left out. And that is so integral into the way that we view our health, is the health of our, our cultural landscapes, and how that, really frames our worldview and helps us to just work in the world. And so really, through that process, I was able to identify like these big glaring gaps that, need to be filled somehow. And so I've been involved. So currently I still work with the, this is still background. I work with the program here called the Superfund research program. And they have 5 or 6 different cores, but I'm in the community engagement core. And we have partnered with CTUIR to do some research. They did the smoked salmon studies and the smoking studies a handful of years ago. And then we also partner with the Swinomish and on a bunch of different projects. And I'm going to share actually one later in my presentation from them. And so really just involved in a lot of things. I'm currently also interning at the Northwest Portland Area Indian Health Board, working on a manuscript actually surrounding violence among Oregon tribal members. And so it's a lot of different things, but all of them are connected. And I've been able to, through my education in public health, really connect all of those because of the way that we view the world. And I'm going to try to get that clarified here in my slides. So without any more background, I will get going. And if anyone has any questions as I'm going along, please don't hesitate to just pop in and ask. Okay. I think I have to scroll. There we go. So Indigenous health in my view, and the stance that I kind of take in all of the arenas that I work in right now, is that it is the root of public health. So I came across this quote somewhere, and I need to find the reference for it, but it felt so true to me when I read it, that I've now that's kind of how I frame this question when I'm asked about, like, what's Indian health, what's Native health, what's Indigenous health, and the quote was, our ways of knowing are so old that they seem new. So the way that we view the holistic impacts of our environment and our social connectedness and the ability to harvest our foods and for our foods to be clean as all as one whole unit of health is not the way that it's viewed, in traditional medicine. So traditional medicine would look at an individual, and for a lot of years, that's the level that the focus was on, right? So treat the individual, what's happening, what are the symptoms, treat the symptoms. And so public health is still really growing, but it came after, a lot of years of just the traditional medicine approach to understand that, well, there are bigger things going on here, and a lot of the diseases and the things that are being treated at that level are lifetime. They occur over the span of a lifetime. So then people started thinking, like, oh, well, maybe we need to be looking more at this lifetime, like these lifetime causes, right? And how people's behaviors are formed, and how people's behaviors are contributing to those chronic disease outcomes that we're looking at, like Thea talked about with diabetes. So when I interpret this to people, our way, Indigenous health is so old. Like we know that those things are all contributing to our health, our spirituality, our ability to gather these foods, and it's this reciprocal nature that we have with our environment, and the things that we need to gather, and the way that we grow up going through these phases where it's dependent upon that reciprocal nature with the environment, and the things that we like the rose bush that she's talking about. That's a significant life phase that you would go through, and same thing with like first kills and first digs and all of those. Like we understand that that's how we see the world, and other people just are coming around to being able to look at the world that way. And so I really just think that we already have all the tools, we have all of the confidence in that system, that now public health in itself is trying to now catch up to, so that we're not providing just that tertiary care when people are already sick. So things are moving upstream, where sort of we've always been more upstream, like, hey, we need to make sure that all of these things are in place so that the human health is sort of at the end of that stream. And so that's the stance that I take. I try to bring this conversation into as many places as I can here at OSU. And like I said, I've been lucky to hold a lot of different positions, and to have supporting mentors and people that are around me that are willing to listen to this, and try to understand it. So this really is just an overview of what that looks like in a nutshell, but in terms that public health uses. So reciprocal determinism is this idea. So public health is really good at just like, let's name something, let's put it in a model so that we know what to expect, right? So it helps you kind of predict these things, these outcomes, especially when you're going back to like a prevention mindset. It's hard for people to envision what might possibly happen if they get sick down the road. When you're 60, you might get sick, and these things might happen. But if you can put it in a simple model, which public health is really good at providing lots of models and frameworks for
thing is getting completely redone. I got it.
There's a mic on, sorry.
I got that, I got it.
It's okay.
You're muted now, Sydelle.
Okay, am I good?
Yes, we can hear you now.
So what I was saying is these models and these frameworks, you know, like put it in a nice, pretty picture, are actually really helpful tools to help further this discussion for people on the other side, right? So I've done a lot of my work, actually not in the tribal setting, but with external agencies that want to work with or are working with and maybe aren't doing a great job, or, you know, like there's just these gaps in their understanding. So it's actually been really helpful to use public health's tools like this one that I'm going to talk about, for example, on the public health field and the practitioners in public health, because it's something that they can understand. It's like this, you know, it's a model and language that they understand what you're applying to it. And so this is just one example of social cognitive theory, and how it really is just what I've already outlined as indigenous knowledge. So Albert Bandura proposed that behavior, cognition, and thoughts, and the environment are all intertwined and enforce each other. So any one of those things can work forward or backward on each other to mold the behavior, the setting that it happens in, and what the person is thinking and thinking through with that, which is exactly what we do. Like for first foods, for example, we know that we want the water to be clean because we need to eat the fish. So that's our behavior. And so that's a really simple way of looking at it. And I'm going to show you another one. These are the 5 core disciplines in public health. And then a really, really popular model that's really easy to understand, and that's the social ecological model. And so that's the round list of things on the right. The 5 core disciplines are health behavior and health education. And I am pretty heavily into the health behavior. That's my doctoral program here is in health behavior biostatistics. I have a little more experience with that than I've had previous to this year after completing this manuscript that I'm working on. Environmental health, I do have quite a bit of background in that with my Hanford experience, and then I've been with the SRP here for, you know, maybe 5, almost 6 years since I came back to school. Epidemiology, which is basically the studying of all those trends. So kind of putting it all together to see which areas need more attention than others. And health services administration, which I do also have experience. My master's is in health management and policy. I did my internship with Yellowhawk, actually 2 internships with Yellowhawk with their strategic management team, and worked on integration. So integrating all of these areas and all of the services that Thea talked about at Yellowhawk, so that there's communication across all of them to get to the public health outcomes that you're looking at. So the SEM model there to the right is a really popular way of looking at things. So if you look back at Colleen's presentation, the circular, you know, like you have the water and everything is like built. It's when you have a lot of information to put into something, it's sort of easy to think of it at these levels. And so you have the individual. So what access, for example, or what impacts at an individual level are climate change is going to have. Interpersonal level, how is that going to affect their ability to communicate, or you know, like we're experiencing with the pandemic now, to interact with your social network, that which we know are really important for individuals, and especially communities that are really close and who have usually lots of opportunities to have social connectedness through different functions. And then organizational, this is, you know, for this webinar, for example, is a prime example of the organizational level coming together to provide information around one topic. And so it really is a reflection of all the stakeholders within the tribe, right? So Thea was here from the Health Commission. we've got first foods and air quality, and this is the 7th one of 10. And so it's a really good example of like pooling all of these organizational resources and what they can bring to the table and the conversation. Community, this is the wider community. So the way that I think of this is like, I imagine once the climate adaptation plan comes together, there will be like a community input or a forum or some way that it gets back to the communities to provide like a wider commentary on it. And then policy, which Thea kind of talked about, at health commission level, you have to take into account all of those levels. How do you streamline the areas that really need a lot of, strategically place them in areas that can be addressed altogether? And so that is it, big picture public health. How do you get all of these 5 disciplines and then apply it to sort of this model that's going to touch each level of of the population that you're looking at? This is an example of the Swinomish, and I have worked with them a few times. I've been up there. There are people in my group actually that help me with some of these links that work much closer with them on this. Because I'm working more on my dissertation preparation and my violence project right now, I've kind of switched gears a little bit. But they were generous enough to provide me with these examples. And I put the links in here. I sent the link over to Colleen, I think, also in the presentation. And the top one is an open access module that is housed here at OSU. So if you click on that or copy that into your browser, it'll bring you to an Indigenous health, environmental health page that was done in collaboration with our group and with the Swinomish. And so they created 2 modules that you can click through. It's got videos. It has a whole outline of how they attempted to adapt to a common framework that was established by the CDC, but then they indigenized it. And so it was really interesting, and I hadn't actually seen it until I was preparing for this talk. And then the other one is Traditional Knowledge in Climate Change, which is just like a sort of guideline document that they put together, like why is it important? And it's sort of a high level thing that if you wanted to share it with different departments or maybe agencies that you're working with, it really outlines things like really nicely, and why putting those things into action is important and to acknowledge. So this slide here is actually how they adapted the BRACE framework, so building resilience against climate effects. So the original BRACE was meant for just like a broad range of communities. CDC provided this framework that goes through these 5 steps of building building resilience. And then what Swinomish did, because they had already created their Indigenous health indicators, and maybe some of you have had the opportunity to see their presentation on that. And I'm sorry that it's a little blurry, but they took their idea of holistic health, right? So that's the 6 circles over on the left side, created those within their community, and now they were able to apply that to this BRACE framework. And I wasn't involved in this, but this is what I see kind of happening here with Colleen being able to get all of these things together. So it's actually really exciting. I feel like it's sort of a parallel thing that's happening. And I think that I didn't go through the second module, but they break down in exactly how they did, how they applied all of the Indigenous health indicators to the BRACE framework in that second module at the top link from the slide before. So another gal that I work with here is in the Research Translation Corps, and she's done a lot of outreach with like youth and sort of capacity building around the idea of like understanding a public health framework and applying it to things in your community. So just at any time, this is something that I feel like if if there was something that you wanted to share at the end, Colleen, of this whole, once you get your climate adaptation plan together, we could do the same thing. I would be more than willing to bring this up to my group, and we could work toward having, you know, the CTUIR module up there. And it's open to everyone, so all students, faculty, anyone can go to the website and get an idea and an understanding of why health is different for us and why, but then applied to something that's familiar and understandable. So if that's at all of any interest, I would be willing to do that. So basically, just in quick summary, like, you guys are always, you're already doing so many of the planning things, right? You're getting all of these pieces put together, you're getting input from all of the community stakeholders, organizations, and putting together a comprehensive plan. So that is the first step always in public health. And then the action could take many different forms. And once you guys get to that step, I could be here to help fill any gaps that you noticed, or areas that I have access to here at OSU, similar to these modules that can be shared, and then assess. So assessment is always really important for especially people like at the policy level, like Althea and the Health Commission, because there still may be gaps, you know, like change is constant. So in public health, we keep applying things to these frameworks and then make sure that we're assessing things in a timely fashion. I have actually a pretty good amount of background also in assessment and evaluation of health programs specifically, and my advisor here is actually, that's her main focus. And so it can be kind of daunting when you get there, but that's an absolutely central piece to improving, right? Because there will be gaps as long as we can keep finding them and moving on and adapting the next round. And that's what public health is for. So good job, you guys. I'm super happy to have been here and talked with you. I don't have anything further. If anyone else wants to contact me about anything else that I'm involved in, my email's right there. If anyone has any questions, I can take questions.
Thank you, Sydelle. That was amazing. I want to leave time for questions. If anybody does have a question that they want to ask Sydelle, now would be a really good time to do that. So just put your hand up if you want, or unmute yourself, and you're welcome to talk at this time. And I just wanted to say, I am kind of low-key obsessed with the Swinomish Indigenous health indicators. They are really cool. They did an amazing job.
They're really good. Yep.
And I know that there are a couple other tribes that have tried to put together their own health indicators that are different. As you have said, everybody is different. And so these health indicators would be a really great thing for helping move holistic health forward. And so, yeah, I'm going to follow up with you once the plan is done and we can go through that module. That would be really great.
So if I had more time, I would have showed their first module. It's just, it was really well done, and it really highlights, you know, because they're a coastal community, right? And so, but even just to equate that to something that we've experienced with the floods recently, you know, the water levels are going to be taking a toll on the rivers also. And so it's just it was a really good example, and like short and succinct, that you can go see, you know, like these were their what they identified as major concerns because of their clam beds, for example, salmon, and, you know, all the way down to having that personal interaction with a doctor and explaining why these things are different for an Indigenous person. So I encourage people to go click through those modules. They were really good.
And I included the links in the chat if anybody wanted to follow up with those, and I'll email those out when we email the recording out of this presentation. So again, I just want to give anybody a chance to ask a question for Sydelle before we move along. I think it might have just been so much information. It was really great. And you said that you have a really busy day today, I know, and so we're hoping that you're going to stay on as long as you can. But any kind of final thoughts that you want to leave us with if you're not able to stay the whole time?
I'm planning to stay. I do have a COVID vaccination planning committee that I'm on after this, but I just encourage anyone to reach out to me. I have a lot of knowledge and like places to point you for more information. So I don't mind getting people that poke me all the time, call, text, whatever. And I feel like one of my main roles here now is connecting people to these resources. Like Thea said, I really am interested in setting up some formal way of getting more sort of Native representation in public health here at OSU, since we have one of the top programs in the country, and like an internship pipeline, because I think it's so important. And people that I've been now schooling alongside of for years and years are really interested, and they want, like, this is the way that all of public health is moving, and I think that they would be great assets to our our public health programs there. So anyone at all, just feel free to email me, or I can provide my phone for further questions.
Thank you. And I know that you've been super responsive and super helpful for setting up this webinar, and I'm really, really grateful to you for that. Thank you.
Thank you for having me.
Yeah.